I want to talk about lower face and neck lift. So as you get older, I mentioned something about position of tissues being a problem. So the support structures that just hold everything up when you're younger start to stretch out, lose their elasticity, and then the fat pads that are in your cheeks will start to descend. And what you'll notice is that you get a hollowing underneath your eyes. We call it a tear trough deformity. You might get lines down the center of your face we call a nasojugal groove. You'll get a deepening of your nasolabial folds, and then you'll start to see some jowling in this area. And then as it progresses, you'll get that loosened skin underneath your neck where it goes from your chin to your chest. We sometimes call that turkey neck. All of those things are positional problems that are going on because the support structures in your face have lost their elasticity and have stopped supporting the underlying structures. And really the best way to treat that is to do a lower face and neck lift and to tighten those things back up, put the tissues that have descended back where they're supposed to be. And in that way, you're going to get the most natural looking rejuvenation. I do see sometimes people using volume to try and restore tissue that's sagging, and you can get a little bit of lift with volume replacement, but I tell people who go in that direction to manage expectations, because the last thing that we want to do is to try and lift your tissues with volume alone, because you'll pass that threshold where you're going to look kind of like that flotation device that and that unnatural, overdone looking appearance. So really when somebody's biggest problem is sag, I'm going to be very honest with them and tell them you really need to do that lower face and neck lift, put things back where they're meant to be, and then address the volume problem. Oftentimes during a lower face and neck lift, I will replace volume with your own fat. That way you have a permanent correction of the volume loss and you're not continually coming back for filler every year or two. But really addressing the problem that is prevalent is the way that you are going to get your most natural result. I think there's a common misconception that minimally invasive procedures are going to give you a more natural looking result, and this is not the case. The truth is that you really need to be addressing the problem properly and not trying to do a minimally invasive procedure when you actually need to have surgery, because it may seem counterintuitive, but sometimes doing more means that you're going to have a much more natural result.